Hi, I'm David Klein. I'm an orthopedic surgeon at Kennedy White Orthopaedics in Sarasota, Florida. In this video, I wanted to show you with the aid of a model what a rotator cuff tear is. The rotator cuff is a series of muscles that originates from the front side and from the back side of the shoulder. This is a model that's a right shoulder that you're seeing from the front. These muscles typically have two functions. They keep the ball in the socket, and they also allow rotation of the ball back and forth in the socket. The rotator cuff muscle that is typically injured is the one on the top called the supraspinatus. You can see that it lies between this shelf of bone on the top of the shoulder called the acromion, as well as the humeral head underneath. When you raise your arm up, and usually the rotator cuff is supposed to follow, this muscle can be pinched between the two bones, especially if the shoulder is mechanically not working quite well. This can cause fraying of the top surface, which becomes like a rotator cuff tendinitis or a partial thickness tear. It can cause a complete tear where the muscle becomes detached from the bone, or even a massive tear where it's both detached from the bone and it retracts. Then if you look into the shoulder, you see the muscle on the front, you see the two muscles in the back, but the top of the humeral head is exposed. Even people with this problem sometimes have no symptoms whatsoever because they can compensate using the muscles on the back and the muscles on the front to substitute from the supraspinatus. Almost like if you're playing tug of war and you have four people pulling on both sides and one of them falls on one team, the three remaining people can really dig in and still win the tug of war match. If you have a problem with your shoulder, this can be treated either with surgery or without surgery, and often that depends on what your symptoms are, what the situation was at the time that you had your rotator cuff tear, or even if this is a tear that just happened very slowly over time and you have no idea when the problem began. I would advise you to see your orthopedic surgeon if you have a problem with your shoulder, lifting your arm, reaching with your arm, or pain that radiates down to the side of your arm. Rotator cuff tears are extremely common, and there are many ways to treat them. Thank you for listening to this Orthopedic Moment.